Sural mononeuropathy is a rare neurological condition that affects the sural nerve, which runs along the lower leg. Unlike more common nerve disorders, sural mononeuropathy is isolated, meaning it impacts only the specific nerve. This makes it a unique diagnostic challenge for clinicians. Patients typically present with sensory symptoms, such as numbness or tingling in the distal lower extremity. Because of its rarity and subtle presentation, it is often overlooked or misdiagnosed. Understanding the basics of sural mononeuropathy is essential for both healthcare professionals and patients experiencing unexplained sensory changes in their legs. Recent retrospective study conducted at a single electrodiagnostic center aimed to shed light on sural mononeuropathy by reviewing 36 cases, the largest sample reported to date. The researchers Lee Ubina and Richard J. Letterman meticulously analyzed patient records to identify patterns and outcomes. Their goal was to better understand the causes, clinical features, and diagnostic methods associated with this rare condition. By focusing on a larger group of patients, the study provides valuable insights that can help clinicians recognize and manage sural mononeuropathy more effectively. Study included 36 patients diagnosed with sural neuropathy. This diverse group represented a range of ages and backgrounds, reflecting the broad spectrum of individuals who can be affected by this condition. While the study did not specify exact demographic breakdowns, it emphasized that sural mononeuropathy is not limited to a particular age group or gender. This highlights the importance of considering the diagnosis in any patient presenting with unexplained sensory symptoms in the lower leg, regardless of their demographic profile. One of the key findings from the study was the diversity of causes behind sural mononeuropathy. Interestingly, non-surgical and non-traumatic factors account for half of the cases. Among these, 7 patients had underlying inflammatory or vasculitic conditions, suggesting that immune-mediated processes can play a significant role. The remaining cases were linked to various other causes, including trauma and surgical intervention. This variety underscores the need for a thorough clinical evaluation to identify potential risk factors and tailor management accordingly. Diagnosing sural mononeuropathy can be challenging due to its subtle symptoms. In this study, routine sural nerve conduction studies were positive in 34 out of 36 patients, making it a highly effective diagnostic tool. For the remaining 2 patients, a distal recording method was used to confirm the diagnosis. In rare cases such as one patient in this study, a sural nerve biopsy was performed to aid in both diagnosis and treatment planning. These findings highlight the importance of specialized electrodiagnostic techniques in accurately identifying sural mononeuropathy. Patients with sural mononeuropathy typically experience sensory symptoms in the distal lower extremity. These may include numbness, tingling, or burning sensations. The study found that most patients did not require specific treatment, as their symptoms were mild or self-limiting. However, a minority experienced persistent sensory issues that impacted their quality of life. Recognizing these clinical features is crucial for timely diagnosis and management, especially in patients with unexplained sensory complaints in the lower leg. Interestingly, the majority of patients in the study, about 58%, did not require any specific treatment for their sural mononeuropathy. Their symptoms either resolved on their own or remained mild. For those with persistent or more severe symptoms, treatment was tailored to the underlying cause, such as managing inflammation or addressing vascular issues. This individualized approach ensures that patients receive the most appropriate care based on their unique situation and the root cause of their neuropathy. Recognizing sural mononeuropathy is vital for effective patient care. Early and accurate diagnosis can prevent unnecessary treatments and help focus on managing the actual cause of symptoms. The study emphasizes that awareness of this condition among clinicians can lead to better outcomes for patients with sensory symptoms in the lower leg. By considering sural mononeuropathy in the differential diagnosis, healthcare providers can offer more targeted and effective intervention. In summary, sural mononeuropathy is a rare but distinct neurological condition with unique clinical and electrophysiological features. This study, the largest of its kind, highlights the importance of considering a wide range of causes, utilizing specialized diagnostic tools, and tailoring treatment to individual patient needs. Increased recognition and understanding of sural mononeuropathy can greatly benefit patients experiencing sensory symptoms in the distal lower extremity, leading to more accurate diagnoses and better overall care.